One of the nice things is to reacquaint with someone that you used to work with like 15, 20 years ago and haven't seen in a long time, and it's great to see Janet Poppendieck here. Janet is the policy director of the New York City Food Policy Center. She's a professor emeritus at Hunter College, the City University of New York, and has done copious research on hunger and food insecurity, and we're delighted you could join us today. Thanks.
Thank you for inviting me, and it truly is an honor to have an opportunity to testify before this hearing of the National Commission on Hunger. I took a look at your mandate, and you have my sympathy. I think it's a very tough order. I have essentially three things I want to say, and the first relates to the part of your mandate that has to do with making more effective use of existing programs, and that has to do with moving toward universal free school lunches. The second has to do with the part of your mandate about public-private partnerships, and I want to express some cautions about public-private partnerships and the expectations that are sometimes generated for them. And the third goes beyond your mandate, and that is that I think you may want to think about a White House conference on food and hunger. Okay, so let me start with school meals. The current school lunch program and breakfast program make enormous contributions to preventing and alleviating childhood hunger in the United States, but they can and must do much more. I am particularly concerned about two groups of students. The first is those who are not eligible for free or reduced price meals, but cannot afford the full price meal. And the second are those who are in fact eligible, but are not making full use of the program. So talking first about the students who are in need but not eligible, too often youngsters who come from families with incomes just over the reduced price cutoff simply don't eat. We have images of brown bag lunches sent from home, but the reality is that those are few and far between in the United States these days. And we have a lot of youngsters who pick something up at the corner store on the way to school and try and get through the lunch hour with it. School meal income eligibility standards in the United States, except for Alaska and Hawaii, are uniform, but the cost of living varies dramatically. The cutoff for reduced price meals, currently $25,727 for a family of three, may be reasonable in Albany, Georgia, where the cost of living index stands at 90.1 of the national average, but a family with the same income may be struggling here in Albany, New York, where the COLI is 108.1, and would certainly be struggling in my hometown of Brooklyn, where it's 181.7. Okay, the cost of living that vary dramatically from location to location. Congress long ago recognized the impact of cost of living differentials by creating separate, much higher standards for Alaska and Hawaii. But Congress has not been doing its homework lately, at least not on this issue. Costs in Boston, LA, San Francisco, San Diego, and at least 3 of the 5 boroughs of New York City exceed those of virtually all Alaska cities. Setting aside the fairness issue, and I do believe there's a fairness issue here, maybe back when we didn't have computer technology and could not have reasonably varied the cutoff standards, maybe it wasn't a fairness issue, but now we have that capacity. But setting aside the fairness issue, the result is that in high cost of living areas, millions of school children cannot afford the lunches that are subsidized by taxpayers and commodity donations on their behalf. The last Child Nutrition Reauthorization, the Healthy Hunger Free Kids Act, actually intensified this problem by requiring that the price for so-called paid or full price meals, which of course are not full price, but are modestly subsidized by the federal government, that they rise gradually until the total from all sources, so that would be the small federal subsidy, whatever residual state subsidy there is, and the child or family's out-of-pocket cost, until that reaches the level of the full reimbursement for free meals. There were equity issues there. The proponents of this change reasoned that if you weren't charging enough for lunch, so that all the contributions equaled the cost of free meals, then that essentially the free meal kids were subsidizing the meals for people who were above the cutoff. And you can make that argument, but the effect is to exclude more and more kids who just can't afford to pay the price for the school meal as that price rises. As I said up front and will say again, I think the solution to this is to move toward a universal free program, and I think the community eligibility program is a crucial step in that direction. Even in moderate or low-cost living areas, we have known for a long time that families with incomes up to twice the poverty level face very high rates of material hardships. To put this in context, I want to say that any cutoff, any threshold that is derived from the federal poverty line is gradually eroding in terms of its real relationship to how people lead their lives in the United States. The officially poor are further and further from the median, okay, because as the cost of living adjustments take place annually, but we don't make changes for the standard of living. So now if you want to get a job, you'd better have access to internet technology, to the modern communications that weren't even part of the picture back when Molly Orshansky figured on the USDA study that a third of income would go for food. So all of the standards that are derived for this, including the capacity of SNAP recipients to spend 30% of their disposable income on food, are eroding gradually over time. But having said that, we know from studies of hardship that the cutoff is not 185% of poverty. This is why Congress permits states to use higher income eligibility ceilings for the Children's Health Insurance Program. In fact, the average state CHIP ceiling is 241% of the federal poverty line, and in 19 states and the District of Columbia, it's 3 times the federal poverty line. Why would we not implement a similarly inclusive standard for access to the healthy meals that can reduce the need for costly medical care? One final note about eligibility standards derived from the poverty line. They are very blunt instruments, okay? They are suitable for looking at large data batches and seeing if poverty has risen over the past 2 years or decreased. But as a basis for assessing the need of an individual family for any particular program, there are lots of type 1 and type 2 errors. You know, if I'm a preacher's kid and we live in the parsonage for free, the income may be below the threshold and I may qualify for reduced price meals or free meals, but I may not need it nearly as much as a neighbor who is paying, an exaggerated rent or who has work expenses or who may be paying off an education loan. These are very blunt instruments. If our goal is to make sure that children go into the crucial afternoon hours of school well-fed and ready to learn, we shouldn't be using a cutoff-based approach. In a fully means-tested program like SNAP, there are various deductions and adjustments to income that help take into account regional disparities like the housing prices or heating costs, and family variations like childcare costs or work expenses. Schools, however, were never set up to administer a means test, and they are singularly ill-equipped to do so. Part of the genius of the community eligibility program is that the means testing is done by agencies better able to do it. It seems to me that a priority for this commission should be the protection and expansion of CEP. And I say protection because it's clear to me, I've been doing a lot of looking back over the whole history of domestic food assistance in the United States. And it's clear to me that whenever a provision engenders a noticeable rise in expenditure, it also engenders a certain hostility in parts of Congress. So I think we have to protect CEP. Let's turn to those children who are eligible but do not eat. I don't have a national estimate, but I can tell you that in New York City on an average school day, about 250,000, or 1/3 of the income-eligible youngsters, fail to participate in school lunch. There are many reasons why students who are income-eligible do not eat them. They may not have a lunch period at an appropriate time. They may be afraid of the cafeteria or the stairwells leading to it. The lunch period may be too short to allow them to get through the line and consume the meal. They may dislike the food. The reduced price kids may not have the 25 cents that, well, in New York City, that's no longer an issue, but the 40 cents in most situations. But those who have closely observed school lunches generally report that stigma is the major factor. In too many schools, as one UC Santa Cruz student explained to me, quote, "The cafeteria was for the poor kids, the food there was gross, the kids who did not eat in the cafeteria were embarrassed to go into it during lunch for fear that others would think they were getting a free or discount lunch." In the early elementary school grades, it's mostly not an issue, but as kids become socially aware and begin that process of ranking themselves vis-a-vis their peers that really characterizes, I think, the heart of the middle school experience, they don't want to be lumped with the poor kids, and too many of them don't eat, or again, get by on that bag of chips from the corner store. The stigma then infects the food itself, the attitudes of kids toward the food, and it becomes a major vector for bullying. And we have a lot of reports, and you'll see a footnote in my testimony that can lead you to that. In New York City, the Lunch for Learning campaign to make school lunch free citywide was very frustrated when the mayor and the chancellor decided to implement CEP only in our freestanding middle schools. We had hopes that we were going to achieve the goal of universal in New York. But there's a modest silver lining here, which is that by implementing universal free in only the middle schools, we have a kind of natural experiment. And we can report that participation with virtually no publicity is up 8% in those freestanding middle schools, whereas it remained level or declined in both elementary schools and high schools. So the reason there was so little publicity is because they couldn't do it for the K through 8 middle school kids or the 6 through 12 middle school kids, but only in the freestanding. And so they couldn't find a way to advertise this citywide and get the word out. That wasn't too confusing. It's an additional 10,000 meals a day. Okay, an additional 10,000 kids a day in New York City in those freestanding middle schools are eating school lunch who weren't eating school lunch last year. We think that this is a very hopeful. The mayor has characterized these results as mixed. We think the mayor hasn't spent enough time in school cafeterias to understand what a big jump that is in 1 year. I won't, I'm a little concerned about my time here, but I want to say that around the nation where schools systems have implemented CEP citywide, the results are generally glowing. I think particularly of Betty Wiggins, who's the food service director in Detroit, who says that her sharpest increase has been in the Voc Tech high schools, where virtually everyone was eligible in the first place. And the only explanation she can think of is a reduction in the stigma. This is the National Commission on Hunger and not the National Commission on Healthy Lifestyles or the National Commission on Effective Education, but I do want to say that there would be enormous collateral benefits from moving to a universal free. We know our kids need to learn more about whole foods, healthy eating, and if school lunch were integrated into the school day, if it finally became a part of education, we would be able to build curricula that do that. I said I would talk a little bit about public-private partnerships, and what I really want to say is beware of the language of public-private partnerships. It's very seductive, okay? It sounds great. I don't know if you might have seen the graphic that Bread for the World recently put out that shows 24 pantry bags or food bags, showing that only 1 out of 24 is from the charitable section and the other 23 are all public programs. The visibility and the emotional resonance of charitable food programs far exceeds their capacity and their volume. And I know you had testimony from food bankers earlier this morning. I am not hearing from food bankers that they are revved up and ready to go to double and triple their capacity. They feel that they are at the edges of what they can do. So I just want to say there's an enormous visibility factor for charitable food because they raise their resources by interaction with the public. You know, we can tee off against hunger, and we can swim laps against hunger, and we can bring a can to the concert, and we do all sorts of things that make us feel better and relieve the distress, but they are really a small player. Do I have time to read you? Am I running out?
You're fine.
Yes.
Okay.
Oh, she's running out?
You're not running out. You have the time. We're giving you the time.
Good. Okay. So
You are running out, but we're giving you some
all
time.
right. No, good. I'll read faster. No, I just couldn't help but think about Christine Vladimirov, who was the CEO of Second Harvest, what's now known as Feeding America, the National Food Bank Network, when I was doing my research on emergency food in the United States. And she was addressing the Contract with America folks at a press conference. And this is what she said. She said, part of the solution to hunger calls for partnerships between the business and charitable sectors, and it counts on the generous giving and volunteering by individuals. But crucial to the effort is the key role played by the public and government sector. Yes, charities do a great job. We are efficient and effective. We are close to the people we serve. We are local grassroots responses of neighbor feeding neighbor. It seems to us that the government can and should look to charities for leadership. We can tell you what works well, what doesn't work, and what might work better. We can show you how to cut out waste and how to have a flat, efficient administration with resources reaching people in need. We can provide you with models of success that can be duplicated. What we will not do, what we cannot do, is concur with those who call for government to cut programs that provide hungry Americans with access to food. Finally, I just want to say, when you invited me to testify, I looked back over other hunger commissions. Of course, the Citizens Commission on Hunger and Malnutrition in the United States in the late 60s made a huge contribution to raising consciousness. But the last national one that I could find was Reagan's task force. And they concluded that subclinical malnutrition and hunger were not measurable, and therefore put out the challenge to advocates that resulted eventually in the Household Food Security Survey and in the remarkable collaborative development process that went into creating that. But in these kind of iterations of history over time, I think the annual hunger numbers now perhaps contribute to a little bit of numbing, a kind of dulling down. And so I think you, as the National Hunger Commission, need to do something to kick this up a notch. I was struck by your question about President Obama's commitment to end childhood hunger by 2015, and where did it go, and where's our visible outrage or protest that it sank to the bottom of the pile. And so a White House conference might be one possible solution or a step to bring this to greater attention. So.
Thank you very much.
Thank you so much, Janet. You have questions?
Sure, I do. I'm very pleased to hear about some of your testimony on school breakfast and school lunch. And the School Nutrition Association has sent us mixed messages, or sent the American public mixed messages about the quality of school breakfast and lunch. And I'm wondering if you have some insight into the quality of school breakfast and lunch and the cost that's associated with improving the quality or keeping the current quality that we have right now.
Okay, well, I want to say that I think the quality has been steadily improving in many communities. My work tends to be national in scope, and I visit lots of communities, and I've seen a lot more lunches that I would choose to eat than I used to. And I think this is partly due to the new nutrition standards, and I think it's partly due to the attention that school food has been receiving. You know, there was a long while where it was kind of a black box, and principals didn't want to hear what was going on in the cafeteria. The kids went in and they came out the other end. And I think there's still a long way to go on principals taking responsibility for school food in their schools. And I would urge it be one of the factors on which principals are rated. participation in school food. But setting that aside, I think that a new generation of very committed, very creative, very energetic young people are being drawn into school food. I don't know if you've seen the Food Corps folks, but they're terrific. So I think there's hope, a reason for hope on the nutrition standards point of view. I am not as dismissive of the SNA's concerns as are many advocates and my colleagues whom I admire, and this comes from having spent so much time in school kitchens and with food service directors. Any one-size-fits-all prescription has some perverse outcomes, and I would love to eventually see us rethink the way we protect the quality of school food, because I think any of these step-by-step prescriptions are going to have some backfire. But having said that, I think that the evidence is in that most communities are able to implement these new standards, and most kids get used to them. So I think the quality is improving. And when I argue for universal free school meals, I believe the quality will continue to improve for multiple reasons. One is because if we are feeding everybody as part of the school day, we'll have more parents with more clout concerned about what's being served there. But secondly, because there will be savings. Joel mentioned some of the kinds of savings in the paperwork size, but there's also, the salary of the food service director gets amortized over the number of meals that are served. So that's a cost that reduces the overhead, in a sense, of school meals reduces as participation increases. So you can free up more money for better food by serving a larger proportion of the kids. And this is what I'm hearing from the communities that have implemented CEP citywide, is that they have more money for food and they're serving better meals and kids are enjoying them more.
Well,
Thank you.
Candidly, given the way the meals are constructed now, if people did participate to the full extent allowed, we'd bear these costs anyway.
Yeah.
So, I mean, in reality, that's a good point. I do have to ask you one question that we've asked others, just your opinion. I mean, every USDA program we have, WIC, school meals, all focus on quality, and WIC has a very clearly regulated health-related food package, and the SNAP program does not. And so, even just limiting the notion to the issue of sugar-sweetened beverages that clearly have such linkage to childhood obesity, diabetes, juvenile diabetes. What is your sense of why we should continue to allow public money, contrary to public health issues, to be spent on items such as that?
Well, I wouldn't mind prohibition for sugar-sweetened beverages. Maybe that's an overstatement, but I am not a fan of the sugar-sweetened beverage industry. I'd love to see us tax advertising because it generates the need for counter-advertising to undo some of the damage it does. I mean, when I say tax advertising, I think specifically for unhealthy products. I share the advocates' long distaste for singling out SNAP recipients as the one group of people who should not be able to exercise the full range of choices that are out there. And this comes partly from a historical perspective that SNAP was, in fact, a replacement for the commodity distribution and was intended to mainstream the experience of poor people so that they became consumers, and that's a very valued role in this society. I also think that it would work very poorly at the checkout counter, at the store level. But I would be happy, and many people disagree with me, but I would be happy to see a substantial tax on sugar-sweetened beverages. I do believe that sugar-sweetened beverages and similar foods impose costs on the society, and I think we would be justified as long as it isn't just the SNAP recipients, because
Interestingly, I find a certain irony in that I tend to have mixed feelings about this issue. But for instance, there are already restrictions on the SNAP program, and we know what they are. You can't buy any non-food products. You can't buy alcohol, tobacco, and you can't, interestingly enough, buy prepared food. And yet, quite on a Friday, quite often, my wife and I will get a prepared chicken. So it seems odd to me that we would underwrite the the purchase of sugar-sweetened beverages that lead to all these public health issues, and we don't allow families to buy. So I'm not sure I agree with you that at the register it would be difficult. And I'm not sure families would be perfectly capable of, and maybe we'd learn something about whether they simply substituted their own dollars to continue the same buying patterns. But it goes contrary to all of our public health issues, so.
I have just 3 questions. First of all, I envy you. You live in Brooklyn. I used to live in Brooklyn. I miss Brooklyn. And I was wondering, what was the neighborhood school that you talked to the parent coordinator at? You said it was-
IS 88.
Which is where?
It is on 19th Street and right off of 7th Avenue.
7th. So it's
Right. Just catty-cornered from Greenwood Cemetery.
got it. Okay. Thanks very much. Not far from Bishop Ford. The second question was, were you talking about the current mayor and chancellor or the former mayor and chancellor?
No, this is the current mayor and chancellor.
And can you give me some idea of what was their concern about? Because it sounds like they're representing some interest or concern about going universal. What is the issue that they're really worried about?
Okay, so I'll tell you as best we know. First off, I have to say that I think the chancellor doesn't fully understand the program. She said some things at the Education Committee budget hearing that made me think she didn't understand the mechanism of federal per meal reimbursement. But she has a budget person who presumably does. There were 2 concerns that were articulated. One was, in New York City, there have always been a pretty hefty chunk of tax levy funds that goes to make school food does not break even in New York City.
Okay.
And so I think there was a feeling that if we went universal, the total amount would increase that the city would need to put in. Our estimate was not by more than $20 million, which, you can say that adds up, but that's such a drop in the bucket of the multi-billion-dollar school budget. But the other thing has to do with the allocation of Title I funds within the city. The total amount of Title I funds that come into New York are determined by census data, okay, the distribution among municipalities. But within the city of New York, the distribution of Title I funds has been based on the numbers of kids who are free and reduced price eligible as determined by the parental forms. And the fear was that the fear has been expressed that if we go universal, parents wouldn't turn in the alternate form, the income form, and that they would have no basis for allocating the funds among the schools. It's complicated by the fact that they use a different cutoff for Staten Island and Queens than they use for Bronx,
So
Manhattan,
it was
and
a
Brooklyn.
budgetary concern as opposed to a flow or educational or curriculum issue or
Yes.
flow in the school?
Yes, I think it was that these were budgetary.
And then on the last, just a little, did the administration propose different cost of living adjustments for different parts of the country in the last child nutrition reauthorization or?
No,
And have they ever proposed universal?
no.
No. So it fairly, it's not just Congress that hasn't done its homework. It's
Yes.
the administration as well.
Yes, that's fair enough. I will say that universal has been the goal articulated by many people since very early, since 1946, and was always the position of the American School Food Service Association and then the School Nutrition Association. And when I started talking to people about universal, I was shy about it because it seemed a radical kind of thing and what have you. But every food service director I talked to said, oh, that would make so much more sense. I mean, this is really crazy
It's a
the
good
way we
point.
do it.
Thank you.
Thank you very much. Appreciate it.